A structure which is seen on the skin of anterabdominal wall is the umbilicus. Umbilicus, it's also known as the omphalos, the term omphalos. Okay, so what exactly this umbilical cord? It's a normal scar which is the remnant of umbilical cord. Okay, so this is a place where the umbilical cord was attached. That is the umbilicus. So remember the position of this umbilicus in adult. It is present between L3 and L4. You can see the third lumbar vertebra, and here we have the fourth lumbar vertebra. It presents between L3 and L4. It is lower in infants and in elders. In case of elders and infants, it is lower case. Okay, and one important structure, the point you should remember is umbilicus is innervated by the 10th spinal segment, T10. So remember by heart this point. Umbilicus is innervated by the 10th thoracic spinal segment, 10th thoracic spinal, and umbilicus is said to be having a white watershed line. Okay, so what exactly the watershed line is? So we have the spino-umbilical line, there is an transumbilical plane is there. Okay, the lymphatics, as well as this is the lymphatics as well as the venous drainage. Okay, in case of lymphatics and venous drainage, the umbilicus is said to be having, or umbilicus is called as a watershed line. So here we have the umbilicus. Okay, so this is a transumbilical plane. So above and below the lymphatic drainage, this is a lymph and the venous drainage. Okay, below the umbilicus it is drained downwards, and above the umbilicus it is drained upwards. That is the lymphatics and venous drainage. So that is why the umbilicus is known as watershed line. Then the umbilical has got some embryological significance. Okay, so we have already seen that umbilicus is the place where, so we have the umbilicus, and out exteriorly we have the umbilical cord. Umbilical cord is attached. Okay, so umbilical cord is attached at the umbilical area. So what is the embryological significance of this particular umbilicus? Okay, that means during the embryonic stage there is something called folds of embryo. There are 4 folds are there. There is a head fold, there is a tail fold, and 2 lateral folds. So 4 folds. So we have, suppose this is an embryo, trilaminar embryo. Okay, so here we have 2 foldings like this. You might be knowing all these things, right? So this is the head fold, tail fold. At the same time 2 lateral folds also is there. Okay, so umbilical is a place where all the 4 folds meets at this one. That is, so I can draw like this. So we have the head fold over here. You want 2 lateral folds. This is a tail fold, and this is the lateral fold. Okay, so umbilicus is a gap. A gap is formed at the meeting point of these 4 folds. So that is known as an umbilical ring. Remember the umbilical ring. So what is umbilical ring? Umbilical ring is a gap at the umbilicus during embryonic period. So we have, remember this umbilical point. So umbilical ring is there. Okay, and some structures are passing through the umbilical ring. So first one is the midgut lobe. You can see the foregut, midgut and hindgut. So the midgut lobe passes through the umbilical ring. Okay, so during the course of development, what happens actually, the midgut lobe passes through the umbilical ring, which comes out of the proper embryo. Okay, so that is the vitello-intestinal. So that particular part is known as the vitello-intestinal duct. Vitello-intestinal duct passes through the umbilical ring, and later on this what happens actually, the midgut lobe. Okay, the midgut lobe will go back. Okay, so why the midgut lobe comes out? Because it helps, because of the development of the liver and other structures. So when the liver and other structures develops in the abdominal cavity, what happens actually, this midgut lobe comes out. So once the development of the other structures completes, so the midgut lobe goes back. So that particular extension is known as a vitello-intestinal duct. Again we have, this is a foregut, here comes a midgut, and this is a hindgut. So from the hindgut there is an extension that is known as the allantois. So somewhat like this. So here if I draw here, so we have the foregut, then we have the midgut, and here we have the hindgut. From the hindgut there is an extension, so that extension is known as the this is allantois. Okay, the proximal part of allantois. From this area, what happens? Urinary bladder develops. Urinary bladder develops from the proximal part of this particular allantois. Okay, so two important structures we have seen at the umbilical ring, that is the vitellointestinal duct. Then next one is the allantois. Then we have the umbilical vessels are there. So we have one umbilical vein and two umbilical arteries are there. Two umbilical arteries and two umbilical arteries and one umbilical vein. So these are the structures present or passes through the umbilical ring. So what are structures? If you draw, this is the umbilical ring. So first structure what we can see is this is the vitellointestinal duct is passing through. Then we have the another structure is the allantois, and we have one umbilical vein and two umbilical arteries. So we have 1 2 3 4 5 structures are present at the umbilical. Okay, so this particular so here if again I'm drawing the embryo proper, so we have the foregut, then we have the midgut, this is a hindgut, this is the urachus or the allantois. Okay, what happened to allantois? So it is somewhat like this. So we have the foregut, it's a midgut, this is drawing like this particular part from the urinary bladder. Okay, so once the urinary bladder is completed, this particular part is called as the urachus. Okay, and this urachus opens into the umbilical ring. Okay, that is a urine which is produced by the embryo will be been excreted through the urachus, is given to the umbilical cord, and the fecal matter which is produced will be passes through the vitellointestinal duct. Okay, then what is the fate of these structures after the birth? So urachus, okay, that will forms the median umbilical ligament. So here we have the medial, this was the urachus, this is you can see the urinary bladder is formed here. So once the urinary bladder is formed, there is no need for this particular communication, so this communication will get obliterated and forms the median umbilical fold. Then we have the umbilical artery was there. Okay, so we have two umbilical arteries were on either side. So these umbilical arteries will be converted into medial umbilical fold. So here one on the left side, then there is one more right side. This is the obliterated umbilical artery. Obliterated umbilical artery will be forming the medial umbilical ligament, and we have what umbilical vein was there. This umbilical vein will be converted into ligamentum teres, which is connecting the umbilicus to the liver. In the there is an obliterated structure which is present present between the umbilicus and the liver. Okay, that is known as a ligamentum teres. Now, so there is a term is called Meckel's diverticulum. What is Meckel's diverticulum? Okay, so remember we have already discussed this diagram, that is a vitellointestinal duct. So vitellointestinal duct is an extension of the midgut. This is the midgut, okay, through the umbilical ring. Okay, so what happens actually, so during the course of development, okay, so this will go back to the abdominal cavity. This vitellointestinal duct or this midgut loop will go back to the abdominal cavity. Okay, if this particular structure does not go back to this umbilical cavity, or it persists in adult, so that is known as it makes a diverticulum, that is known as Meckel's diverticulum. This is a midgut loop, this is the future umbilicus, okay, and this is the persistent vitellointestinal duct, that is known as Meckel's diverticulum. Okay, there is something called rule of two in relation to this Meckel's diverticulum. It occurs in 2% of the subject. It is present 2 feet from the ileocecal junction. In 2% of the cases it is symptomatic, and 2:1 male prominence, okay, more in case of male. And sometimes this structure or this Meckel's diverticulum causes intestinal obstruction. So what is in Meckel's diverticulum? Meckel's diverticulum is the persistent vitelo-intestinal duct. Now, what are the conditions associated with the persistent vitelo-intestinal duct? The first one is called, vitelo-intestinal duct. Okay, we have seen that. See, I am drawing again. So we have the foregut. This is the midgut. This is a hindgut, foregut, midgut, hindgut. This is, urachus or the allantois. This is the vitelo-intestinal duct. Okay, then what happens actually? This persistent vitelo-intestinal duct leads to Meckel's diverticulum. Okay, so there are different conditions associated with that. First one is known as vitelline fistula. Fistula means, what is fistula? It's an abnormal communication. That is the fistula. Okay, so here what happens actually in the vitelline fistula, that is there is the communication is persistent communication. Okay, so that is called vitelline fistula. What happens actually if this fistula or this communication persists, the fecal matter which is produced in the in the midgut will passes through the umbilicus. So that is known as a fecal fistula. Another condition, if the allantois persistent allantois, what happens? The urine will drip through the umbilicus. So that's called urinary fistula. Okay, another condition is called vitelline cyst. You can see vitelline cyst. Here what happens actually, there is no communication, but the communication is obliterated, but it makes it forms a cyst in between. That's called vitelline cyst. So here you can see there is no communication, there is no fistula, but a cord-like appearance, like a vitelline cord. And here you can see Meckel's diverticulum. What is Meckel's diverticulum? So diverticula is present, but it does not communicate with the cavity or the umbilicus. Okay, that is a Meckel's diverticulum. So here we can see Meckel's diverticulum along with the cord. These are the different anomalies of vitelo-intestinal duct. Now, I told you during the beginning of the 6th week of intrauterine life, the rapid elongation of the gut and the increased liver size reduces the intra-abdominal space, which pushes the intestinal loop out of the abdominal cavity. I already told you. Okay, so during 6th week, what happens actually? The elongation of the gut as well as a formation of liver. Okay, so it pushes the midgut loop out of the abdominal cavity during 6th week. Around 10th week, what happens actually? This intestine returns to the abdominal cavity. It will go back to the abdominal cavity. Okay, and if it does not happen, if it did not go back, what happens actually? The persistent loop, okay, after the closure of the umbilical ring. So this persistent loop, which is found to be out of this umbilical ring. So these conditions is known as the exomphalos or the omphalocele. That is the persistent gut loop. Okay, which is seen at the umbilicus. So that is known as the exomphalos.